Hello, fellow foodies, and welcome back. This is Dr. Cassandra Quave, and you're listening to Foodie Pharmacology, the science podcast for the food curious. If you're a fan of the show, you can support us by heading over to our link to give me a coffee. This is how we raise funds to help with the show's production. Thanks for your support. And today we're going to talk about another interesting plant molecule, not from the coffee family, but from a very different family. But first, let me introduce you to our guest. Our guest today is Jonathan Dickinson. He is an entrepreneur and the chief executive officer and co-founder of Ambio Life Sciences. He's one of the world's leading experts on Ibogaine and brings over 15 years of experience in traditional practice and psychedelic research to his leadership at Ambio. He's the former executive director of the Global Ibogaine Therapy Alliance, and he co authored the field's foundational safety guidelines and has published widely on Ibogaine's therapeutic, cultural, and ecological significance. I'm really excited to speak with you today, Jonathan, and learn more about this really interesting plant derived molecule, Ibogaine, and its origins. So thanks for coming on the show.
Well, thank you. It's a pleasure to be here.
Great. Well, let's start with the plant. So, as I mentioned at the show's start, this is, it's a bioactive plant molecule known as ibogaine. It has impact on the brain. But it's from the Apocynaceae or the dogbane family, which can be both a toxic family, but also a family that has lots of really important medicines like cancer therapeutics. So it's an interesting family to look for new molecules. What can you tell us about ibogaine and its source, the Tabernanthe iboga root where this molecule comes from?
Yeah, so Tabernath iboga, or we just call it iboga for short, is endemic to Central Africa, and especially to a very small country called Gabon, where it's been used for thousands of years in traditional healing rites and rites of passage, and that use continues today, and it's by that route that we come to know about this plant and this incredible molecule. There's ibogaine in other kinds of plant sources, but Tabernacle iboga has a really strong concentration of it. So it's possible just by eating like the second layer of the root bark from this plant that you can have a really strong ibogaine effect. So it's been known about in the West for about 125 years, and it's had a number of different therapeutic uses outside of Africa since.
Great. So, I mean, we've talked about other psychedelic medicines on this show, including, oh gosh, ayahuasca, which is this mixture of monoamine oxidase inhibitors and harmala alkaloids. We've talked about psilocybin from the psilocybin mushrooms, but this is a bit different from those. What can you tell us about ibogaine's like pharmacological effects? What do we know about how it works and what its effects are?
Yeah, it's really interesting, and I think it's fair to say that we don't have a complete picture of how it works, but we know that it does a lot of different things. So ibogaine is has low affinity, we say, for a number of different neurotransmitters in the brain. So unlike most psychedelic compounds that are mostly targeting a very narrow kind of range of serotonin receptors, ibogaine doesn't really seem to have the same type of effect on serotonin. It does kind of modulate serotonin receptors in a similar way to, say, SSRIs, but it's not completely clear exactly. There's a little bit of a unique way that they do that. And it also has effects on the dopamine system, the opioid system, NMDA neurotransmitters, as well as sigma receptors, all of which kind of seem to have little signals about, oh, it might be helping to address chronic pain because of NMDA or sigma pathways, or it might be using those to produce neuroplasticity, sort of underlying the effects. But also NMDA and serotonin both might be related to these psychoactive effects. So it's really hard to kind of pinpoint one thing that it's doing, rather having this kind of broad effect on a number of different systems.
Nice. So, you mentioned that the concentrations are really high in the root, so you can have a experience from the pharmacological properties of this plant in traditional uses. Can you tell us a little bit about what those traditional practices look like, and what do people like? What is the sensation that people go through when they take this root?
Yeah. So one thing that Ibogaine is really well known for is being a rather difficult experience, and in part because it's very long. But when the effects first come on, it kind of helped to differentiate it from what we normally think of as a psychedelic. So if you were to take something like mushrooms or LSD, which are sort of the classic hallucinogens, it can kind of feel like the environment around you is sort of lit up or saturated with kind of movement and energy or breath and significance. And the feelings that come up internally as well, like the thoughts or the emotions that you're experiencing, can also feel like have this imminence or sort of importance, weight to them. And so it becomes difficult sometimes to know where the normal boundary between us and the environment is, because everything is kind of pulsating and we feel very connected with everything that's going on. In some ways, Ibogaine could be described as almost the opposites. Like, people are not generally very interested in what's going on in the space around them, and, you can be aware of it. Ambio, the clinic that I run, if you are taking Ibogaine and you need to go to the bathroom, you can raise your hand and have a conversation with, one of the nurses about navigating back and forth back to the mattress and that. But it's almost like none of the external world matters very much. There's this gravity that kind of pulls you inward. And even there, so the things that come up, people often describe it to the point of like watching it on a TV screen. So rather than feeling like they're being pulled through, it's almost more of this position of being kind of a witness of what's being presented to them. And so I think that's kind of a distinct position to be in, because you can be very aware of your normal train of thought. You seem familiar to yourself, and you're aware of what's going on and what you're doing and all of that. But there's also something else that's confronting or being presented to you. And so sometimes it can almost feel like in the midst of that, that there's like others that appear. Sometimes people see family members or people they don't know, or some kind of guide or something that appears to them. And so it can almost feel like while people are in the medicine experience, that there's this kind of interaction, right, with something else, or even a conversation that plays out. Like they're having an inner dialogue that helps them to unravel problems or think through things in a very deep and profound way. And so while all of this is going on, there's also a strong physical effect. So it's, not just curiosity that pulls us inward, but there's this heaviness, this kind of weight that pulls us to want to lay down and close our eyes. And people often, if you do have to get up, the reason why you would put your hand up and ask for help is because people get quite ataxic and have a difficult time walking. People get a little bit of trembling, trying to reach for the water bottle or something like that. It can cause nausea and vomiting. So there's all these kind of strong physical effects. And, like I said, it also can be quite long. So if you're taking a significant amount, the way they do in Gabon traditional practice and the way that a lot of our programs are structured at Ambio, it's something that people can be engaged in all night. And then even the next day, you're not ready to go and get some sleep right away. You have to rest and recover. And there's this kind of enduring after effect that can last for, again, another 24, 48 hours afterwards. So I think in short, it's fair to say that it asks a lot from us. It kind of presents us with a lot more than we're used to experiencing, but it also gives back a lot. And that happens both psychologically as well as physically in the body. And we're starting to learn more and more about the kinds of things that it's doing in the body and in the nervous system.
That's incredible. I mean, as you're speaking, I'm thinking about how this compares to other psychedelic medicines in different cultures. And for example, in the Amazon with ayahuasca ceremonies, it's typical to have music, kind of whistling or movement of the shikapa bundle. You've got a spiritual guide with you in these traditional contexts. And I think there's very much an engagement with the life around you and the forest. Healers that I've interviewed have spoken of this, of how they communicate with forest creatures, with the plants, with animals. And so with Ibogaine, is there also kind of a ritualization of sound or of other aspects to ceremony that we might see? Also, we see some similar concepts with like mescaline and peyote ceremonies where there's might be sounds, there might be or usually guides present. Like, how does that compare in that traditional context? Is music or other aspects, are those included?
Oh, yeah, absolutely. So the traditional practice that surrounds Iboga and Gabon is there's different branches, but it's generally known as Bwiti. And so in Bwiti, there's many different tools. And so there include instruments and colors and scents and rich kind of tapestry of symbolism that kind of goes into the temple and into the practice and the things that are kind of part of the ritual. So, as far as the music goes, I think in the West, we're used to a rather structured type of rhythm and also harmonies and the way that harmonies kind of link onto rhythms. And in Bwiti, the experiment with layers and layers of polyrhythmic sound. So to an untrained ear, or if you haven't taken ibogaine, and so you're not listening as closely as you would be, it can sound a little bit chaotic almost. But if you do have that opportunity to hear very closely, there's a lot of kind of intricacies, and the one of the reasons I think that those sounds can become compelling and useful is because they're always changing. There's things that are repeating, but the way that all the sounds interact with each other are always happening in new ways and new configurations. So it gives you a lot to focus on and a lot to work with. So, yeah, music is an incredibly central tool in Bwiti, and there's different types of instruments and sounds that kind of guide different parts of the journey.
Incredible. Well, I know I'm familiar with some different palliative care physicians who are running studies on psychedelic assisted psychotherapy, especially for terminal patients or patients that have like a terminal cancer diagnosis to help them kind of process what they're going through. And I've heard of the use of psilocybin and ketamine in these processes, but I'm not aware if any of these trials are including ibogaine. Are you aware? Like, do we have clinical studies happening right now in the US on Ibogaine for kind of in the context of psychedelic assisted psychotherapy? Or what else? What do you know is happening in the clinical sphere right now?
Sure. So I haven't heard of that specific use in a research study where they're using ibogaine to sort of confront end of life anxiety. But where ibogaine has shown a lot of efficacy and where most of the research has focused is on issues that bridge the mind and the body in a deep way. For example, ibogaine has the capacity to mitigate the withdrawals from opioids, which are famously difficult, especially for people who've been habituated for a long time and have unmanaged patterns of use. And so Ibogaine has this ability to resensitize the opioid system, essentially to a state where the body's no longer physically dependent. Like the tolerance that's been accumulated to opioids is reversed to pre-use state. So what that means is that people don't go through withdrawals, but then have this opportunity to also have a dramatically reduced kind of cravings afterwards because the body's not trying to go and fill this gap. So going through cold turkey withdrawal from opioids or other drugs, usually, it takes a really long time for the body to come back to a complete homeostasis where it feels like we're completely self-managing both pain and mood and everything like that. So that even after the week of sickness that you would imagine for somebody coming off of heroin, people can struggle for months or a year. And so I think Ibogaine can give people this really big head start in recovery, like if they're going 6 or 9 months up the road. And I think that gives a really strong footing that there's nothing else that does that. And more recently, we're seeing other kinds of uses. So about 4 or 5 years ago, there started to be growing interest amongst special forces operators, like guys who had been out in Iraq and Afghanistan and in a really high rotation of deployments and being around conflict, which basically expose them to explosions and also other things that would sort of move their head around at jarring rates, like high caliber weapon fire and stuff like that. So there's, you know, a lot of research coming out that's describing mild traumatic brain injury as the sort of signature wound of this global war on terror. And so, it's become of growing interest for a bunch of different groups of people from including veterans and athletes to try to understand what there is in terms of regenerative treatments. And right now there really isn't anything, but we've been able to see evidence. I mean, we see it day in and day out clinically, but we've also done a study with Stanford University doing brain scans with patients before and after, and they were able to show really physiological changes in terms of how blood flow and electrical activity was returning to damaged cell tissue in the brain. That's what I mean. Like normally when we think of soldiers coming back from war, we think of post-traumatic stress disorder because of the things that they've seen there and that the difficulty of combat and coming home. But the symptoms of traumatic brain injury are actually remarkably similar with post-traumatic stress disorder. It's just that they can also include things like headaches and light sensitivity and other kinds of neurological symptoms. So that's what I mean. Ibogaine has shown a lot of promise in treating things where there's potentially a mental and spiritual component, but also a deeply physiological component as well.
Amazing. So let's talk a bit about trials and practice. So your practice in bio is based in Canada. In the US, I understand it's that Ibogaine is still listed as is it Schedule 1, right?
Yes.
Yeah. So that means for listeners that it's not a legal drug you can access in the United States right now. But in Canada, how is it regulated? Is there a special regulation?
So our company is set up in Canada. However, we just manage clinics outside of the country as well. So right now, if you want to come to Ambio for treatment, the where we're operating out of is actually in Mexico, just south of the US border in the Tijuana and Rosarito area. And by January, there's going to be sites open in Malta as well. But yeah, Canada doesn't restrict ibogaine the same way that the United States does, which is as strictly as you can possibly control a substance, but it still doesn't allow for clinical use in Canada yet. It would be a lot easier to do research here than in the States, but we can't unfortunately operate clinics or provide ibogaine to patients here.
Got it. Yeah, this is one of the challenges with the restrictions. Like Because I think there is so much promise for a lot of these plant-derived molecules that have a long history of traditional use in managing, like you mentioned, traumatic brain injury, managing addiction behaviors with other, ironically enough, other plant-derived molecules, like morphine from the opium poppy.
Mhm.
Um, but they're exceptionally difficult to study in university settings because of these very, very strict restrictions on access, even for scientific studies. Um, I want to ask, so there are changes. I don't know how familiar you are with advocacy in the United States. I seem to recall seeing some news about from Texas. Are they proposing legislation to kind of in favor of more research on Ibogaine, or what can you tell us about what might be happening in the United States when it comes to access or research on this plant product?
Yeah, there's actually a lot going on in the US right now for Ibogaine. I think for years, Ibogaine was positioned as the kind of dark horse of the psychedelic world that people mostly didn't know anything about or was kind of, associated with drug detox. And so, yeah, it seemed like a sort of distant prospect. But now there's multiple different fronts. So one would be, before he got into office, RFK tweeted that he thought Ibogaine in particular, but also other psychedelics should be rescheduled. So that would be one thing that would lift some of the barriers that you were just describing to being able to do research with it in the United States. We haven't seen any further movement on that, but it's been part of that level of conversation. And then more concretely, so in Texas, they sort of followed up on an initiative that started in Kentucky. And that was, I think, in 2023. It was Brian Hubbard, who was the chairman of the committee that was going to allocate the funds that the state was receiving from the opioid settlements following all the damage that was done during the opioid crisis. And so it was a significant amount. It was, approaching $900 million. And they wanted to dedicate 5% of those funds towards ibogaine research to see if that would be a viable treatment avenue in this state. Unfortunately, it faced a bunch of challenges, and Brian was taken out of that position that he was in by the incoming attorney general. So Brian ended up with other allies in Texas, and what they've done there is essentially something very similar, where they've got $50 million allocated towards FDA approved clinical trials with ibogaine. It has to be matched with another $50 million brought by a drug developer, and that drug developer has to work with some Texas institutions to be able to do the research. But I think one of the things that they're attempting to overcome and hopefully successfully overcoming here is that it's difficult sometimes to work with plant compounds because drug developers cannot patent them. They're not novel inventions. And so you don't get the same type of patent protection. And therefore, it's more difficult to generate the kind of investments that you need to go through the entire FDA drug development process, which can cost hundreds of millions of dollars. So they're opening up this opportunity by providing state funds. And it seems like there's other states that are looking to join in coalition to provide those kind of funding. And there's also sort of in a different avenue entirely, Colorado, which was, um, I think it was, I don't remember exactly when they did, but very recently they've successfully implemented a program for the therapeutic use of psilocybin mushrooms in the state. And this is just through like a state level initiative. And so the next priority on their docket there is to create some kind of similar regulation for ibogaine. So they're attempting to fast track the development of some kind of a ibogaine therapy availability in the United States through that state program.
Amazing. Yeah, this is you hit the nail on the head when it comes to some of the challenges and working with natural products. It's ironic because if you think about so many of our leading drugs, they are natural products. And so drugs that we depend on today would have never passed the gauntlets of being patented back in the day because of this new interpretation of the law by the Supreme Court under the myriad genetics ruling. But I want to talk about some other aspects. We've spoken about ibogaine, and this is an alkaloid. It's known as kind of the primary active molecule in the plant. But another factor with plant medicines is that there's never just one compound. There are others in the mixture. And to really access the full traditional medicine or the source of this molecule, you need to do so at this point, I believe, through accessing the roots. And so, one thing that really piqued my interest was that, if I understand correctly, you're the first and I think still the only person to have negotiated a Nagoya compliant deal with the country of Gabon for access to this plant. Tell us a bit about that. Like, what does it mean to be Nagoya compliant and how does this work?
Sure. So Nagoya is a UN treaty that's part of the broader sort of Convention on Biological Diversity. And what Nagoya was seeking to address was the contribution, I think, that indigenous communities in developing countries have made transferring intellectual property or sort of traditional knowledge into what became sort of Western industries, including pharmaceutical sciences. And so it's in some ways it sort of functions like a intellectual property kind of mechanism, right? So for me to have an agreement with the country of Gabon, with directly with communities there, it sort of is like a licensing arrangement where I have access to the material, and then there's benefits that I share back with those communities and with the country. And so that looks like different things. I mean, there's a monetary benefit that I share, but there's also non-monetary benefits that can be a part of that. And a big part of it is to try to engage so that Gabon is able to see and participate in the opportunities for economic development that are going on outside of Gabon. Um, One of the things that happened very recently is the first lady of Gabon. She has a foundation that she manages. It's involved in a range of different activities. Announced the development of a clinic for youth in the country who have become exposed to an increasing number of opioids, like tramadol and other things that are entering the country, as well as people that undergo different kinds of violence and experience, different kinds of trauma. So the idea under Nagoya would be that we've learned all of these very specific uses outside of Gabon. And so for us to be able to share sort of knowledge and training and that kind of intellectual resource back to the country is, in a lot of ways, just see it as like sort of right and just, but sort of Nagoya provides a structure for that to happen, right? So those are the kinds of things that Nagoya does. And the process of getting there, there's some very specific elements of Nagoya. And one of the most important ones is that it has to begin with free, prior, and informed consent, which means that you have to go before you start working to the communities and make sure that they understand exactly what it is that you're going to do and that they're not coerced in any way into participating in it. And then that provides a sort of fair, more fair basis for an agreement to take place. So the agreement that I have, it took about 4 years to develop. It was the first time that Gabon was implementing Nagoya and forming an agreement, not only with Iboga, but with anything. So they were sort of developing out the legislation and the program. And I think that's similar in other parts of the world where Nagoya is kind of new and we're learning how to implement it in different contexts and different industries. But I think it has a lot of promise.
That's incredible. I mean, just as a point of reference for listeners, if we think about some of the plants that have influenced our lives, that influence them every day prior to Nagoya, You can think of coffee as a good easy example. Coffee, traditional beverage from Ethiopia that spread across the world. It's I don't know how many millions, maybe even $1 billion business. I don't know how it's huge business in coffee, but of course, none of those real proceeds are going back from the spread and economic, development of coffee back to Ethiopia under an agreement. So the idea is that, that cultural traditions where these ideas originate and where the genetic resources originate receive fair participation in the development of those products. So I think that's fantastic. It's the right way to start this.
Yeah, and another kind of useful example is if anybody has ever drank rooibos tea, that is
Mm.
actually an example of a product that is subject to an access and benefits sharing agreements that has made it kind of international. It's a very good example of what that kind of agreement looks like.
Yeah. I've really found South Africa to be a leader and when it comes to sorting out a lot of the structure for Nagoya. My lab collaborates with a university in South Africa, and it was so easy to go through establishing a Nagoya protocol with them
Mm.
because they had this very like well established infrastructure. And there are other countries that we work with also in the lab that really don't. They just have a very fledgling office, and it does take quite a long time because they're trying to just sorting it out, but it's important that we do this. That's great.
Absolutely. Yeah.
Yeah. Well, I wanna talk a bit, like, to help bust any myths that people might have about Ibogaine. I guess myth number 1 or question number 1, is this a recreational drug? Is this something that people can become addicted to and do all the time? And why or why not would you qualify it as that?
Well, I think for a number of different reasons, it's generally not considered to be recreational. And for the most basic reason is what I described earlier is that it can be very difficult to go through. It kind of asks you for quite a lot up front and it gives back a lot later, but it's a challenging process. And so it's not something that people generally tend to repeat, or at least not very often. And another reason is because there's a lot of kind of inherent risks. So one of the effects that ibogaine has on the body is that it can block the uptake of potassium, which into cellular cells, which is important for regulating the heart rhythm. And so if you're already deficient in potassium or your heart is already under certain types of strain for other reasons, then this can cause a problem and lead to arrhythmias. And there's been a number of hospitalizations and fatalities that have occurred closely associated with ibogaine. So you described, earlier in the episode that I worked with an organization that developed clinical guidelines for ibogaine assisted detoxification. And so over the last 10, 15 years, we've learned a lot about why that occurs and how to mitigate those risks. And so now when we're providing ibogaine at Ambio, we have layers and layers of screening and then monitoring protocols. So essentially when you're going through the journey, you're hooked up to a cardiac telemetry unit like you're in an intensive care unit at a hospital. It doesn't look like you're in an intensive care unit at a hospital because we try to make the environment very comfortable and nurturing and appropriate for the journey that you're going through, but it has the functionality of an ICU, and there's a ACLS trained team with all the full crash cart behind you, just like you'd have in a hospital. So that's another one of the reasons that it's not generally considered recreational. But I can also say that having been to Gabon a number of times and participated in ceremonies there, it can also be profoundly beautiful and enjoyable. It's just that it has this deep seriousness and weight that comes along with it as well.
Yeah, so it's not something that's going to make you feel good necessarily while it's happening.
Sure.
You mentioned some purgative effects, vomiting. Is there I know with ayahuasca, there's definitely and also with peyote, there's a purgative effect of those therapeutics. So it's,
Yes.
yeah, it's not a necessarily fun experience, but an enlightening experience is what it sounds like to me. How if someone does have an addiction based on what we know so far, and I know that we need to do a lot more research on this in this space, but if you have someone who has developed a very strong opioid addiction, is one session enough typically? Like, and maybe this is just an anecdotal observation from your clinics, or multiple doses, multiple experiences necessary to really get over that? Kind of what does it look like for based on what we know so far? And I know there's a lot of open-ended questions there that we just haven't addressed scientifically yet, but
Sure. Yeah, and, part of the challenge with even doing science in order to answer that question is, what do we consider success?
yeah.
Because, if we're talking about, does it help to mitigate the withdrawal and, get people, like, does it perform the detoxification? Yeah, we're very confident about that. And, sometimes it requires a little bit of additional dosing the day after, when we encountered an increasing rate of people coming down using fentanyl, that's a much stronger opioid. And so the protocols had to be adjusted and things like that. But yeah, as far as the detoxification goes, Ibogaine is very effective. As far as like long-term sobriety, there's so many other variables and factors that go into that, right? Like if somebody is experiencing chronic pain, obviously the use of opioids can, at first can help with that and then can develop into more and more complications that people want to get off of. But at the end of the day, if they're coming out with still a high level of pain, they're unable to manage by any other means, then it's difficult. And so, as that can be physical pain or, also kind of emotional pain, right? And so, I think people who are sort of best situated to benefit are people who approach it themselves when they're at the point where they know that it's time to make a change. And usually, when people have a little bit of experience behind them in terms of what it takes to be in recovery and where their slipping points are and stuff like that, Ibogaine can become an invaluable tool and just make the recovery journey so much smoother. So I don't say that people need to wait for that point, but those are just the type of variables that can make a big difference. The level of preparation and readiness and what's waiting for people back home.
That's great. And from kind of a psychotherapy perspective, we've talked a lot about addiction, but you mentioned that as part of this process, people are confronted with, kind of hallucinations of other individuals or challenges that they have to confront in their mind throughout this process. Are there risks in addition to benefits of this confrontation? Like, I'm thinking in particular individuals that may have faced severe trauma or trauma earlier in their life or recent trauma. Like, are they are there psychological risk factors to consider if they can handle facing that trauma face to face, I guess is what I'm asking.
Yeah, I think with anything that we're gonna do that's an intense kind of journey like that, I think yes, but also I would say in some way less so than with other psychedelics. And one of the reasons I say that is we don't see people have really strong negative reactions to the Ibogaine, like they're having a terrible trip and they're in a loop or whatever we imagine like might happen with LSD or something like that. And I think one of the reasons is because it makes you lie down and close your eyes. Right, and so if you were doing that the entire time that you were on mushrooms or something like that, and you kept going back to just being there with your eyes closed, and you wouldn't have to face, trying to be in the psychedelic space at the same time as trying to navigate the sort of social world around you and the kind of tensions and conflicts that come up around that. And so the fact that it kind of physically guides us to that inner point, I think takes us quite a long way. And so we don't see the same kind of rate of adverse reactions that you'd be
Right.
typically concerned about for a psychedelic.
So it sounds almost like a kind of a very intensive meditation. process. Would that be accurate? Yeah.
Yeah, sure. I think it's a good way to put it. It doesn't mean that the experience is comfortable,
Yeah.
and sometimes people find it really challenging. It's just that for us it looks like they're asleep and they
Mhm.
come out of it like because they haven't done anything crazy in the world around them that's embarrassing or anything like that. They've just been laying there and sort of
Yeah.
facing inwards and ultimately plowing through it that, within by the morning or by later that day or something like that, there's a sense of you can arrive at this kind of completion or the sense of having like overcome that by confronting it. And so I think it sort of physically guides us through that journey in a useful way.
So we're almost out of time. I could speak to you for hours about this. There's so many questions I have, but I guess I'll end with this question. Where do you hope to see, like, what's your strategic vision or your hope for Ibogaine research, Ibogaine use, the public? What would you like or hope to see happen when it comes to this plant?
I think I get to be just a witness to all this that's happening and be blown away by everything that's going on. So I don't even know what to hope for beyond what we're seeing. But other than I didn't come to Ibogaine because I was coming off of opiates originally. Like I kind of had other things in my life. Like I was coming off of antidepressants and had a difficult withdrawal. And it's been interesting to me in the last 5 years watching the veterans come down and sort of reshape the story of what Ibogaine is and what it's doing and teach us by going into the brain scanners about what's happening in the body. And we're seeing that, story continue to open, right? Like we're seeing a bunch of professional athletes come down who have all been playing football or hockey or fighting in the UFC or other sports where there's a high rate of head injury involved, right? And so we're seeing the story gradually expand about what Ibogaine is and what's actually going on. And kind of on the bleeding edge of that, we've been developing this neuroregenerative program. And so it's for people who have neurodegenerative conditions like Parkinson's and multiple sclerosis and ALS, and just kind of creating a space because we're receiving more interest from them and creating a space where it was possible to go. It was wheelchair accessible and was able to adjust to an older population or folks who have more like muscle spasticity and find a different way of working that was really focused on trying to address the physical symptoms. And so, anyways, I would hope that we just get to continue to learn about this incredible plant and that, it helps us to understand what it is to heal. I think that's the gift that it has to offer, so that we continue to be able to tell that story.
That's amazing. Oh, I share that wish. I'm excited to see what else we can learn from this really exciting plant alkaloid. I mean, we have so many success stories in medicine where millions of people, tens, hundreds of millions of people across the globe have benefited from these plant-derived molecules. And it's so important that we study them and understand, how we can use them to help individuals going through different challenges. So thank you for sharing this knowledge about the plant and your journey and working and also establishing this great Nagoya compliant process with Gabon. Where can we send our listeners to learn more about Ambio and your program?
So Ambio, you can find us online. The website is just ambio.life.
Okay, great.
Yeah.
Ambio.life. That's AMBIO.life. Awesome. Well, thanks so much, Jonathan, for coming on the show. It's been great speaking with you.
Yeah, thanks for having me. Pleasure.
All right, you've been listening to Foodie Pharmacology, the science podcast for the food curious. I want to thank our producers, Rob Cohen and Christine Roth, for producing this show, and thank you, our listeners, for tuning in. You can find this and our other recent videos on our YouTube channel at Teach Ethnobotany. You can also help the show keep going. We're in season 7 now. We want to make sure season 8 happens. So help us make it happen by donating to our cause. You can do that at Buy Us a Coffee buy me a coffee. We've got a link up on the video screen, but we've also got links directly on our website at foodiepharmacology.com. Thanks so much for listening. Stay healthy out there, and I'll see you next time.